My name is Casey Kelly. I am the Chief Innovation Officer at an organization called the Meadows Mental Health Policy Institute. We're based here in Texas, but we work nationally and internationally. And part of my job as the Chief Innovation Officer is to look for opportunities where real-world innovation is being delivered, and to use that on-the-ground, real-world intel, if you will, to fuel and feed our national and state-level policy work here in the United States. And I'm really delighted to be here today with these awesome leaders who are at the forefront of leading real-world implementation of technology driven by generative AI in support of our mental health workforce to increase access to high-quality solutions for more people who need services. Before I introduce our panelists, I'd like to just get a better sense of who's in the room. So for a show of hands, who works in mental health care or brain health in any way? Okay, of you, who are service providers? And do we have any developers in the room? What about investors? Awesome. And how many are based here in the United States versus internationally? United States? Europe? South America? Asia? India? Awesome. Well, thank you guys for being here today. Feel free to scoot up. We're going to have a candid conversation. And we're going to save some time at the end for questions. So as you're hearing the discussion today, think about what you want to ask our experts. AI is here. AI is here in healthcare. And AI does have the ability to transform mental health care for all of us in the near term, if we can learn how and be disciplined to use it responsibly. So to kick off the discussion, Sam, I'd love for you to introduce yourself, say a little bit about the organization you represent and how it's using AI, and then we'll go down and dive into our discussion.
Absolutely. Thanks, Casey, and it's great to be here with this group and this audience today. My name is Sam Dorson. I'm one of the two co-founders and the CEO at ReflexAI. We've been using generative AI since 2018, so a few years even before ChatGPT awareness came out. And the earliest use cases that we deployed was focused on training. And if you think about training a pilot, you want your pilot in flight simulators that are as realistic as possible, as often as possible. And that was true in the mental health workforce as well. I led crisis line operations before this, and we deployed the crisis contact simulator. And we've expanded on that at Reflex over the last few years within training as well as within quality assurance. And I'm very excited for the discussion today, but with a real focus on how do we amplify the kind of impact and scale of the human workforce that are fundamentally supporting people across this country and around the world with mental health challenges.
Thank you, Sam. Emily?
Hello, everybody. Thank you so much for being here today to talk about this issue that is so near and dear to all of us, and it's wonderful to be here with you all today. My name is Emily Feinstein. I'm the Executive Vice President at Partnership to End Addiction. We aim to prevent and address addiction and substance use disorders by providing families, community members, and professionals, including providers, with trusted information that they can use to help a young person. One of our signature programs is direct support for family members who are caring for a young person who is at risk for or struggling with addiction. And that is a free national digital program. So our first use cases of AI have been within that program. We began with data analysis using natural language processing to understand better conversations we're having with families, what their needs are, sentiment analysis, understanding stigma and how stigma colors conversations and how it changes over time after we're providing services to them. So we have been gleaning a lot of insights from that. Our second use case was working with ReflexAI in our peer support program. So we train parents with lived experience to offer peer support to other family members. And we'll talk more about this later, but we used AI in our training program to create simulations that allow for unlimited practice on key skills that the coaches need, and also for QI review of cases. And that's really been transformative. We are slowly rolling out other use cases of AI. Our next one is to replace our static logic model within our risk assessment tool with AI so we can better customize and individualize the output of prevention recommendations for families.
Thank you. Tommy?
Hi, everyone. My name is Tommy Marzella. I use he, him pronouns, and I work with the Trevor Project. I serve as the Vice President of Social Platform Development and Safety, which is a really fun way to say I'm in charge of all of our peer programming. For those of you who haven't heard of the Trevor Project, we are the world's leading suicide prevention and crisis intervention organization for LGBTQ plus young people. And most people know us for our crisis counseling services. Last year, we served just north of 500,000 young people throughout the United States and Mexico. And we are using AI in a number of use cases. So when you think about training our counselors on the crisis side, we have deployed AI solutions to help train our counselors for stronger efficiencies as well as scalable operations. And then on the peer support side, where I work, as young people are joining our platform, having conversations online, we are using it in a way where we are able to understand what they're talking about, and should they start talking about suicide or other harms are introduced into the conversation, it would flag it to us and our trust and safety team so we're able to escalate and intervene should we need to. And it's a constantly wonderful and evolving area for us, so we're really happy to be here today.
Thank you all. Let's dig in a little bit. At the Meadows Institute, we uniquely operate at the intersection of policy and practice. And one of the questions that we're always asking and curious to learn from partners about is, how are they learning about their innovations so that they can be better positioned to scale their impact? Can you guys talk a little bit about how you are, and what are the key learnings that you are gathering to assure that you're driving impact and being positioned for scale?
Yeah, absolutely. So I'm happy to start with that question. So I think when we are thinking about AI, one of the things I want to start with is we have a number of programs at the Trevor Project, and it's not just about using it within one program, but it's sort of how does it scale across the continuum of all of the services that we offer. So I think I want to kind of just dive into that and give you some examples. So I talked a little bit about our crisis simulator. So we had the opportunity to partner with Google.org for a fellowship. We brought in 20 fellows to help build this program with us, where really the intention of it is how can we scale quickly and effectively. So prior to this simulator, it would take a person to train a volunteer that came in. Any conversation or role playing could take up to 90 minutes. There's prep, there's time involved with that. And so that was one use case that was helping. Now, as we are looking throughout our other programs, I lead our peer-to-peer services. Another tool that we launched, also in partnership with Google.org, was called AutoMod. So as young people are having those conversations online, we wanted to start looking at suicide risk assessment models and how what young people were saying might indicate a risk for suicide. So through that partnership, we were able to start to build this model out. So we're looking for means, a plan, a time frame to suicide, and as those things are being introduced into the conversation, it's appropriately sort of being scanned and then escalated to our team. And then sort of by risk, it could be triaged in a way to ultimately get to the most imminent situations first. So I think the biggest learning to kind of put a cap on that point is, as we're thinking about AI, it's not to just be siloed in one area of the organization, but rather something that's across all of our programs, and how do we weave it in for real world impact.
I love how you're building it into your training through the simulations. Emily, how are you thinking about your improvement processes and measurement so that you're positioned for scale?
Yeah, I mean, I love actually very similar experience. So I'm on the operations side. I lead all of our programs. And what we've seen is, well, two things. First of all, I think AI is a great tool and it can be used in different instances. But where you really see this transformational growth is when you've first taken the time to identify what are the real barriers that you're facing in your programs, what are your rate limiting factors, and then how can AI be a tool to really radically change that. So some of the instances in which we're using AI just casually at work, it's kind of the next step. And it's great and it's some sort of level of growth. But where we've seen this massive transformation is where we saw that we were hitting barriers in our programming. And for us, similarly in our peer program, questions of training, capacity, and quality were rate limiting for us. And when the team started building AI, it really energized the team. We also worked with Google. We got to do one of the Google Innovation Accelerator programs. And I think it really got the staff thinking about themselves in a new way and our impact in a new way that really followed through in the way that we've redone and rebuilt our whole program and the way we talk about it and the way we market it. And when the quality started coming in, when we saw the way that the coach skills were improving so quickly and the contentment that the coaches had with the new training process, they felt prepared to take on their first coaches. They felt supported, and we saw that they were using the skills we were training on in real time. And now all of the teams across the organization are thinking about, okay, how can we address new barriers? And so we're seeing that again, that this accelerating change and accelerating innovation helps us to accelerate our impact.
Yeah, it's interesting. I've heard you describe it as a bit of a contagious, people have wanted to have more and wanted to learn more, and once they were able to sort of touch and use the augmented supports, that it really did spread. And I think that's often the case, when we talk about AI and the abstract, it seems sort of daunting, but once people get to touch and feel it and actually see how it can be useful to them in their everyday work and life, it catches on. Sam, I know this is something you're thinking a lot about as the founder of ReflexAI. So can you chime in here and build upon or disagree if you have any disagreements?
Yeah, I think I'm going to aggressively agree with some of it, but maybe with a different lens. So we have the privilege of working with partners across the country, all different size organizations. I lost count. I think it's 14 states, everywhere from 10 employees to 10,000 employees. And the first question that I always ask when we start working with a new partner or someone thinking about working with us is, what gets you up in the morning, and what keeps you up at night? And from those two questions, you very quickly understand what's the priorities of an organization and where are their problems. Because fundamentally, AI should connect to the mission and it should address their problems. So by starting with those two very simple questions, what gets you up in the morning, what keeps you up at night, and Emily, I know we had this conversation pretty early on as well. You learn very quickly, for a lot of organizations, it's, I want to do better by my team, that they deserve more practice. And they deserve practice that doesn't require our trainers to do one-on-one role plays over and over, give feedback on those conversations over and over. What if our team was looking at the analytics and focused on other things rather than doing the manual work? And the same is true on quality assurance. What if you didn't have to listen in on 3% of these interactions and really just hope that from those interactions you get the insights that you need to drive continuous improvement? What if you could look at data across 100% of the interactions and explore where are those challenges and strengths across your responder base, whether that's peer coaches, 988 counselors, care coordinators, mental health clinicians, sales and support teams, whoever it is. So I think it's really about the AI as a tool, and having done generative AI for, I guess, 6-7 years, it's a tool in the toolkit, right? It's not the be-all solution to the problem, but you have to fit it into the solution, and then that has to be done in a way that's secure, that's reliable, that's high quality, and ultimately intuitive for the users.
I love that. We talk about technology being only as good as the system or the people that are able to use it. And AI, I think even more so, as the potential is there, but unless you have the infrastructure and a system in place, and the will of the people to use it, it is, the value will be unrealized or underrealized. But getting those questions answered at the outset of what are the problems you're trying to solve and how can AI be one of the tools, I think is really, really important. The other thing I've heard you guys talk about, and that we hear all the time in mental health care, is the need to increase access and the need specifically to help someone get to services efficiently. And this notion around speed of service is really, really important, particularly in the work that you guys are leading. So how has this urgency and this need to have more efficient and speedier service delivery, how has that impacted your work and how you're thinking about, in this case, putting AI to use as a tool for you? Emily, do you want to start, and then we'll...
Sure. Well, for us, one of the ways in which we think about speed is the time from which a parent indicates that they want a coach, a peer coach, and then the time we connect them to that first coaching session. We used to have a wait list of parents because we couldn't train enough coaches to have a large enough pool. Now that we have AI in our training, we can train 4, 5, 6 times as many coaches a year. And we've now come to the point where we have a wait list of coaches who are waiting to get their first parent assigned to them, and it's completely flipped. So that's a really great problem to have. Obviously, we care a lot about our volunteer coaches, and we want them to have a good experience too. So now we're not thinking about our parents, but our coaches and their time to having their first experience. The other thing that we think about with time is quality, actually, and addressing quality. I know this is a weird thing, but Sam was just talking about the QI, and for us, the real-world implications of this are huge. So when we had humans conducting QI on our peer coaching cases, we're a nonprofit. We didn't have the bandwidth to review every case. I don't think it's a secret that QI generally, when it's human conducted, you're looking at a percentage of cases. In the past, we had a time period where you'd identified a few pretty problematic issues in some cases. And the clinical team felt really strongly that they wanted to pause the program, that they didn't feel comfortable letting it go forward until we identified really what was going on. So we paused the entire peer coaching program. We reviewed a large enough sample of each coach's cases so that we could identify which coaches were struggling and needed to be retrained, and then we retrained all those coaches. Wow. That was like an 8-month to a 1-year process, right? Think about how much that slowed us down. Now, with our peer coach training, with the AI simulation and our quality assurance, we already have an insight into the coach's quality before they take their first case, right? So we already know before they're live how they're doing. And then with the QI, we have instant feedback on the cases. So we went from months to minutes in our quality assurance. And really, the thing that's just you can't put a value on is our confidence in the quality of the interactions that the families are getting is now 100%. So those have been really transformative ways in which we're measuring speed to service.
I really do appreciate the tension around speed to quality. You know, we talk a lot in mental health care about this need for increased access. I'm very happy that people are now talking about it from a need for increased access to quality services. And like, kudos to you and your team for taking the time and investing the time so that your deployment was positioned for the greatest success of quality while you're sort of accelerating adoption of this new innovative tool to support. Tell me, how do you guys find the right tension between that like need for speed and making sure that you're being responsible and that the quality of service is in place?
It's a great question. I think to start, one thing that we do is we look at the clinical research that is out there about suicide to better understand where does someone rank on a risk assessment, so whether that's not suicidal all the way to imminent risk, and then we need to take those insights and embed it into our AI model, right? So as a young person is calling into the Trevor Project, there is a risk assessment on the way in to help us understand where are they, is there a plan, is there a means, is there a time frame? Because I think the other reality is that anything can sort of happen at any moment in the world that might lead to a demand increase, right? Like there can be an external activity or event or thing that happens and suddenly our demand rises. So as our demand rises, different people will be at different places in their crisis. So to help with that, we need to rank that and triage it appropriately. So I think that that's one way that we're starting to do that. Another way on sort of the speed to quality piece is the platform that I run, Trevor Space, has, we're just about to cross over 700,000 users, likely in the next few days. Not all of those are active users, but over the course of the duration since the product has been launched. And we have found that users create a lot of user-generated content. There's a lot that happens, and on any given week, we are looking at 70,000 to 100,000 pieces of content that are created or responded to on our platform. That would be a lot for our team or for anyone to go through one by one. So through the power of AI, we're able to input, these are the things that we care about that happen on our platform. We certainly care a lot about suicidal ideation. We care about bullying, harassment, other harms. And then we look to help, again, triage those with risk scores based on the data sets that we have. So from the quality piece over time, and I know we'll continue to talk about this throughout this panel, we're able to improve that based on the data sets that we have to get more accurate along the way.
And pulling you in, Sam, I know one of the groups that you've been working with the longest is the veteran community. And any government agency, as I would imagine, speed may not be what they're leading with, but can you talk about how you have helped them find the right balance of that need for rapid response while making sure that the services were being positioned for efficacy and quality?
Yeah, absolutely. So the phrase that gets thrown around a lot is day one readiness, and that's particularly true in the mental health field. But there's two parts of that. There's day one and then there's readiness. Right? And there's a fundamental question of when is day one? Right? You've hired someone, now they need to go through training, and the entire time they're in training, they are not yet supporting anyone, right, or in the role. And then once you get to day one, the question is, how ready are they? And what we've seen across partners is, and this includes our work with the VA, is you need to solve for day one readiness. And you need to solve for it as how quickly can you get to day one, and what is the bar that you set for what it means to be ready to do the work, because you don't want someone, they can be technically on the lines, but if they're learning for the first 6 months and everyone they're talking to for those first 6 months is not getting fantastic service, then day one is actually day 90, and they spent 90 days in a more challenging situation for the mission than would be otherwise. So for our partners, we think, what does day one readiness mean? And what you've seen, and we've seen this with Partnership to End Addiction, you get to day one faster and you get to day one better, because you have statistics that show, okay, 95% of users, and after every simulation, every single user can rate the tool, right? They can rate us, and it's 95% positive. And it's positive because they have the skills, they're improving on their skills, but they're also improving on their confidence. So when you get to day one, you have teams that have gotten to day one faster, and they have the skills and confidence to do the work. And I think that's something that historically has been a real challenge in mental health and other fields, is how do you accelerate day one without sacrificing the readiness component? And when you have the hands-on practice, you get there sooner, but you also know, oh yeah, this person's gone through 8 simulations and you can see their skill curve improve, you can see their quality, they're ready, right? And they're ready sooner than they've ever been before.
I love that. Can you also sort of help the audience understand? I mean, Emily talked a little bit about talked a lot about like needing to sort of pause until their team was ready. Tommy talked about how they're using sort of their data to assess for level of risk and then make decisions about readiness depending on level of risk. You just shared sort of making sure that you're investing the time to know when day one is. Can you talk a little bit about when maybe you thought you had the right day one, but then needed to do some additional training because like what happened to like maybe move that day one out further and how you're working to improve that and helping other organizations improve their ability to know when is the right day one?
Yeah, so it's a very short question and a slightly longer answer, but I'll start with that, and our approach at Reflex, the term that we use internally, we call skill signaling. And the idea for this is if you want to know if someone's good at riding a bike, you don't put them in a parking lot and say bike in a circle. Because even if they're terrible at riding a bike, they still might be able to pull that off. What you want to do is you put them halfway up a mountain on a mountain bike and say bike to the bottom. And if they do that without falling off, spraining their wrist, getting scratched up, then you know they're good at riding a bike. And part of the simulation work that we've done is not just you do practice, but you engage in practice that provides a clear skill signal to the team. And this is important in healthcare, this is important beyond healthcare as well, because it lets you actually say definitively, okay, we've spent 60% less from a time and money cost on manual training, and we're actually more confident in the skills. The flip side to that, though, of course, is not everyone's ready at the same rate, right? And so being able to see with very accurate simulations that are consistent, that are constructed in a way to test those particular skills and provide those particular skill signals, not everyone's ready at the same moment. Someone might need additional intervention time from a trainer who doesn't need to spend all their time doing manual role play, so now they have time to actually help those folks over the finish line. And then you can provide additional simulations to make sure that they're ready. So to me, it's about the thoughtfulness of the construction. And I know we're talking about mental health best practices here with this group, but it's also about adult learning best practices. Fundamentally, the work that we all do is adult learning at its core. And there's a real science to adult learning on how do you actually train on skills and test on skills correctly, given that you have adult learners. And once you embrace that in the kind of AI-powered training, you get to have it's much more fun, first of all, and it's also much more effective.
Thank you. One of the things we've been touching on and touching around a little bit in the discussion so far is really finding this tension for your responsibility as an organization who's a leader in driving innovation with AI in mental health care. And I would love for you to share a little bit more about what each of your organizations are doing to assure quality and safety and how you're putting AI to use without a lot of government regulation and requirements in this country, at least, to date. Kelly, let's start.
I'll jump in. For us, I think there's three components to safety strategy. It's culture, it's strategy, and it's policies and procedures. We think about it when we adopt new technologies. We evaluate every new technology for risk. So I think culture is very important. If you're not thinking about and talking about risk and in the habit of thinking about and talking about risk at work, then you're probably missing things and you're probably not taking it seriously enough. So a culture of risk. Secondly is strategy, and we have two strategies specifically when it comes to AI. The first one is when we partner externally, we partner with partners who we trust and who have similar values that we do. We were very lucky to work with ReflexAI, and I'm sure Sam will tell you about this, but they require ethics training for every one of their employees. That's amazing. I'm sure it's rare, and it makes us really feel like, okay, these are folks we can partner with. We are thinking the same way. So partnering well. And then secondly, we have a very intentional go slow strategy with AI. We've determined that we are going to start rollout with the lowest risk incidence use case first, and then build on it gradually. So data set processing, very low risk. Using AI simulation and QI and training coaches, low risk. Down the line in the future, it would be public-facing anything that's public AI that's interfacing with anyone who we're serving. And not only does that help us to control risk, but we're learning as we go, and we're getting smarter as we go, but also the technology is evolving as we go, right? So by the time we get to the riskier use cases, we'll have a better culture, we will have used it and have better comfort, and I think the risk mitigation generally out there will have progressed as well. And then the last thing is policies and procedures. I mean, I'm a little biased about this, but I think it is important. We have an AI use policy for our whole organization that governs not just the tech we build, but also just day-to-day tech that people are using at their computers. And we've rolled this out and trained the whole organization on it. My chief information officer was recently at a tech conference, and they had a room, and everyone's asked, who's using AI? And everyone raised their hand. And then they asked, all right, who has a written AI policy? And he was the only one who raised his hand, and he came back, he was shocked. He's like, how are we the only ones? I was like, well, we have this great culture here. Those are all the ways that we are feeling very comfortable about using this technology.
Well, and kudos to you, because in the conversations I'm having, when we're asking about internal AI policies, people want to have it, but they don't know how to do it. And so I'm sure some of those folks in the room probably reached out to your colleague to see if they could look at your policy. Sam, tell me about this ethics training.
Yeah, so we had what I did not realize was such a clear policy that others didn't, which is we felt like everyone on our team is in some way involved in the delivery of our tools. That's true of our sales and marketing team, that's true of our finance team, that's true of our engineers, that's true of our product managers, that's true of our customer success team. They should all be trained on AI ethics. They all go through cybersecurity training, they all go through HIPAA training, they all go through several other trainings. They should, of course, go through AI ethics training. And we just made the decision they were all going to. And then we made the decision, how are we going to do it? And we found, to my mind, one of the best AI ethicists in the country and said, how do you suggest we train our team? Right? If you were in my shoes, what do you wish that every CEO and founder across the country was doing? Because I just want to do that, right? And we work with Reed Blackman, who's Harvard Business Review's AI ethics columnist. He's advised the Canadian government and basically the who's who of the Fortune 500 on this, in addition to Reflex. And we put 100% of our team through AI ethics training. And next year, we're going to do it again. And the year after, we're going to do it again. And on it we'll go. We'll continue to evolve the training. And I think this speaks to the private sector has a role to play in responsible AI, right? We can talk about government regulation, sure, right? But that will not get us to the finish line that probably everyone in this room and beyond wants if organizations that are doing this work don't take seriously responsible AI and make it part of their value proposition. So, we do that. It has implications in our data set development. We do not use customer data to train generalized AI models. Why? Our job is to deliver for our customers, not to say, let us hoover up all your data, and from that we'll magically create something that works for you, right? And it has to do with all the HIPAA compliance, GDPR compliance, SOC 2 compliance, high trust compliance, right? The acronyms go on. And it is at its core about responsible AI. So that when we come to folks like Emily and say, here's what we can offer, and here's how we offer it, the how we offer it part becomes a competitive advantage for us, not oh damn, she has to go talk to her lawyers about it, right? That it's something that we can just solve. And it comes from having done this work firsthand, right? And knowing what it means to be in other people's shoes. So, long answer again, I guess, to a shorter question, but you have to live responsible AI. If you just say you have AI values, but you haven't trained the team on how to execute against them, or you don't put it as part of the commercial value proposition of your organization, it's going to be very hard to deliver it consistently for years.
I love that you have, I think, made the case, beautifully that it's not just the right thing to do, it's actually been really good for your business. Invest in this level of assurance and responsible.
Our customers and our prospects have told us that. So, well, you know, that's certainly anecdotal, but it certainly helps to be able to say, we're doing it the way that we would want it done if we were in your shoes, right? That's the easiest way to put it.
So I'm going to shift gears a little bit now that we're done having all the fun talking about regulation and quality assurance. To really let's start looking towards the future. And we know that these tools are going to continue to evolve. And we also know, as responsible users of these tools, that we're going to need to continue working to improve them. And so how have your organizations started thinking about how you intend to influence how they are improved and how you are using them to improve the services that you are delivering? Tommy, do you want to kick us off?
Yeah, happy to. Thank you. And I really love this question because I do think it's constantly evolving. So I've talked a little bit about some of the vendors that we've worked with in the past. And one of the things, as content gets flagged to our team for escalation, whether that's in a trust and safety realm or a suicidal ideation, it's really important that that's accurate and that it's improving. So there was one external vendor that we were using. As young people were posting on our platform, we were finding that how they were using language, how the conversations that they were having among LGBTQ young people, there were certain words or phrases that were flagging at higher false positive rates. So, for example, that could be as simple as using the word gay or lesbian, right? So if you are using a vendor and perhaps as we're getting closer to the use case for us, we knew that we had to do some improvement there because we really wanted to focus on areas that we felt were going to be higher impact, right? So we're focusing on helping people who are experiencing suicidal ideation, so we wanted to ensure that our focus was more there. So this was a high false positive rate for certain types of language, and perhaps it, maybe you see that if you're on a news article and you've seen the comment section of a news article, we all know that those can be challenging. So as we're applying AI to our use case, we needed to work with the vendor to improve it. And so we were giving examples. Here's what we're seeing. Here's what's happening. Our trust and safety team is identifying this. And through that work with them, we were able to reduce that high false positive rate down to a threshold of 5% or lower from the 39 that it was at. What I really love about that and in working with vendors is they take that learning and then they're able to increase it across the ecosystem of other people who are using that. And even at our dinner last night, we were talking about the importance of having subject matter experts within certain disciplines and how that insight can really help to improve across the larger ecosystem of AI. So I think the biggest thing for us is as we're identifying areas that we feel may be problematic or challenging, that we're relaying that information back and we're coming up with a plan to get to a measurement that we feel is acceptable for us.
And I love the collaboration you just described with various vendors so that the rising tide, if you will, raises all boats. Sam, you're in a unique sort of spot on this topic because you have the privilege of working with lots of different types of organizations and perhaps can see macro needs. How do you think about that and how are you integrating that at the helm of your organization?
Yeah, our success is tied to our customers' success. And I think there's another level that we're starting to see now as we get into 2025 around the impact on really tangible advanced analytics of the AI tools. So I've used a lot of buzzwords in one sentence. I'll try to use fewer in the next 2 sentences as I explain it. But one of the things that happens after you finish a simulation or after you do a live interaction that's then assessed via the AI models is you get feedback on a wide range of dimensions. And those dimensions can be kind of the classic soft skills around your ability to build trust, your ability to gather information effectively, as well as the hard skills, right? Your ability to follow certain protocols correctly according to highly complicated flow charts. And it's not just that you have a success rate on those dimensions individually, but you have actual members of your team who have actual patterns of performance across those dimensions, and that's having an actual impact on the individuals you're serving. And so being able to say, this 15% of your team is struggling with these two things simultaneously, and also that is leading to calls that are 20% longer and have a 10% lower satisfaction rate, right? How are you gonna address that? And that's very different than we looked at one call on one person, how did they perform, right? And it's particularly exciting in training because if you're training 100 people, there's probably some patterns of performance. Some folks are naturally better at some things, some folks are naturally better at other things. And you can actually tailor training and say, okay, based on the first half of training, this group is crushing these things, less so on these. This group has the reverse. We're gonna break this group up into two, and we're actually gonna have a training experience that reflects where you are today. Mm-hmm. And that would be completely impossible if you were trying to score every conversation manually, because the noise from intercoder reliability of 4 different trainers assessing would likely dwarf the signal that you need, and also you wouldn't get that dwarf signal until 4 weeks later when you actually had time to catch up. So I think as we talk about continuous improvement, the tendency is to say, how will the AI itself improve? And that's super important. I mean, we've been on Gen AI since GPT-2, right? In 2018, we had our own virtual supercomputer and we're doing it from scratch with OpenAI, right? It feels like 6 generations ago. The AI will continue to improve, but I think that's only one ball that we're juggling. It's also, how is this gonna impact the missions? And that's about operations, right? That's fundamentally about operations and measurement, not just the models themselves.
Yeah, so I can geek out all day long on measurement. Emily and I started it over lunch, and I love how you were just describing, that last point you made I think is really important. And I wanna just reiterate it and then pull Emily in here too. We have less than 20% of providers in mental health care who are using any kind of measurement in their practice. And therefore, we don't know if they are having an impact on the services they're trying to deliver on. And through the lens that Sam just described, and not just how the AI can improve, but leveraging AI with having our providers leverage AI can help our providers better know how to improve and better understand if they're having any success or need to change course on the types of services they're delivering. And when we have less than 20% of our current workforce that's using any kind of measurement, what is the risk of not leveraging this new technology is the question that I ponder more than the question of using it. Emily, I know you also feel really passionate about this measurement topic and the role of AI in helping your team improve. Can you talk a little bit about how you think about it and how you're operationalizing it?
Yeah, so I think this idea of skills is really exciting. One of the things I'm most excited about generally in mental health and AI is skill acquisition in professionals, paraprofessionals, and peers. I think with the use of AI sims and instant feedback, we're going to see a much lower barrier to acquiring new skills, acquiring them quickly to day one, and then delivering them to patients, which is really exciting. One of the ways that we want to improve and see some room for improvement with the technology and the work is cultural competence and language. We do a lot of work ourselves in really understanding the difference, particularly in addiction, which is a stigmatized issue. We see different ways that families approach this, different comfort in talking about it, different somatization of symptoms, different decision-making processes between different generations in a family. And so being able to have AI adapt those all of those differences will help in the future, I think, make it stronger. And right now in training, the old school way we were doing it was having providers code cases. So we also train professionals in the field as part of my organization. And so I think leveraging AI is going to be a much easier and efficient way of having providers code their own sessions, not their own sessions, but actually just practice sessions to get that skills acquisition. And the other thing I think for us, the potential in the future is we are a digital behavioral support organization offering digital, individual, customized solutions. And AI is really, I think it's going to transform that for us. We're just starting with that, with the customer-facing education. But as we're able to understand more dimensions about family interactions and what's going on and provide better customized feedback, I think people are going to get solutions and information that really feels more right for them than we could even have done with a human interaction. So that's, I think, a really interesting way in which the future will be higher quality.
Yeah, and the quality through not just the measuring of the outcomes and the measuring of the skills development, but in the level of precision that we're going to be able to generate those skills and match those skills to need, I think is really one of the most exciting things that Gen AI is bringing to our workforce. So we are coming up on the time where we have some time for questions. If there are any questions in the audience, feel free. I think there's a microphone, if my eyes are right tuned today. Looks like we have one person. Hi. Will you just introduce yourself and say where you're from?
Okay. Good afternoon. I'm Claudia. I'm from Brazil. I have a digital health consulting. My question is about a family issue. My wife is a mental therapist, and always we start a conversation about how to use AI. The answer is no, it's something devil that you cannot use that. What is the message for her and any mental professionals that has some resistance to use AI in a day-by-day?
Who wants to take Sam? You want to take that?
So AI, I think we can first of all acknowledge that AI is not magically a term that everyone will be excited about, right? But as we think about how it's used in daily life, there's a lot of ways that we should genuinely be excited, right? And the example that I've given folks in my life who are skeptical of AI is, what if you were on the jet bridge about to get on a plane and you were told that pilot really doesn't believe in flight simulators and they've never used one? Are you taking that plane, or are you going to say, actually, I think I'll take the next one? You're probably going to take the next one, right? So intuitively in daily life, the value of AI is clear. The question then is, how is it used, right? And as we think about things like training, instant feedback, I think Emily said it quite well too, and Casey, you've said this, the risks of not using AI are quite high, right? That if you're not using AI in training, are you giving folks immediate feedback on how they did in a way that lets them continue to improve? Or are you saying, actually, we just hope they get better without feedback, right? Or feedback that comes several weeks later that's less tailored. So I think I would say I fully understand the ability to identify risks of AI more easily than the risks of not using AI, because we've lived in societies without it for so long. But when you start to put a closer look on it, you start to realize, the more you think about this, and it's been a while, it's really important to think about the benefits of using it and the risks of not, and you get a very different picture.
I'll just add quickly, because I've been the proselytizer of AI in my office across all different use cases, and I've seen that the resistance has been overcome when you find a problem that person is facing that AI will help them with. So if I generically talk about it, people don't understand or resistant, but when I say, okay, what's on your to-do list that you're struggling to get done? What are like the 5 things that are hanging over your head? And then I tell you, this is how AI is going to solve this problem for you today in 30 seconds. All of a sudden they go, what? And then I do it in that call. Mm-hmm. I'm like, all right, let's just do it. And then they have the thing done that was at their to-do list hanging over their head. That's when they're like, okay, sign me up for the training. So I think the contextualizing it in the person's life in a way that feels not only comforting, but solving something for them has led to breakthroughs in my experience.
Yeah, I love that sort of grounding it and the need or the problem that they're trying to work through. Great question. All right. You just say your name and where you're from.
Yeah, I'm Martin Rotman. I'm here at Delmed here in town, Dell Medical School. So in line with this question that was just before me, as well as the comment that you mentioned that you have less than 20% of staff being able and willing to adopt AI modules in this system. Is there an opportunity, and can you talk about partnerships that you may already have to help people get accustomed to this even before they come into the workforce? So at an education level, can you tell me about any partnerships you may have in that space?
Can I just repeat the question, make sure that we heard it? Are there opportunities to integrate education and training for using AI in medical training programs?
So I can start a little bit here. I've been thinking about one of the areas that we focus on, which is we are, in a way to increase our volunteer base, we are partnering with colleges and universities, right? So like that is probably the closest application that we have at the Trevor Project, where we're partnering with universities, we're partnering with colleges as a way to increase our volunteer and counselor base. And then as part of that, they're going through these trainings and simulations, which you know, while they're in their, whether it's fellowships, undergrad, wherever they may be in their journey, that's probably the closest use case that we have for us. I would invite others to chime in if you have.
And I actually, while I was in town this week, met with the Dell Medical School's Associate Dean of Innovation about this topic to actually talk through whether or not there would be some opportunities for us to collaborate on either training programs or apprenticeships or skills building programs earlier in a variety, non-clinical healthcare workers all the way up to licensed providers' ability to feel comfortable and interested in leveraging this technology. Would love to talk to you some more about it after. Thanks for the question.
Hi, I'm Matt. I'm a researcher at UT. And I guess what I'm trying to do is get a picture in my mind of what a Gen AI training looks like. You know, I've taken a lot of trainings. It's like animation, video-based, bunch of text, quick quiz at the end. Can you give us a better example or a more detailed example of, is it the AI generating the content? Is it the AI generating, like, how does that work? Can you tell us more? Give us an example, I guess.
Who's most excited to talk
I
about
was
this?
going to say, I spend hours a day thinking about this, so I'm happy to be the excited one. So let me put myself in the position of a user, right? That you've learned a lot of content through an LMS-based training, through in-person, through Zoom-based classes. And historically, you might have done some of those kind of quizzes or polls within Zoom or whatever it is. Historically, they would then say, okay, 10% of you are now going to get matched with a trainer who's going to do one-on-one role play with you. The other 90% go on break or practice amongst yourselves, right? We're going to pair you up and you're going to practice yourself, which just screams inconsistent, right? So instead of that, within the Reflex platform, right, everyone in that cohort, if they're doing this simultaneously, logs in, sees their training journey. There's 5 simulations they need to go through. They're about to start the first one, and it will tell you, okay, you're at this point in training, right? That some of the, and this is all tailored by the organization, right? You're about to do this role play, right? Here's a bit of context. This person that's calling in is 42 years old. They're particularly stressed about X. This is their goal, right? Don't forget to follow what you just learned in training, X, Y, and Z. And then you're dropped into the simulation, right? And if it's a voice-based one, you're starting the conversation just like you would with someone calling the crisis line or calling the care navigator. And you go through that entire conversation within the interface. You finish the conversation, about 10 seconds later, your feedback pops up, right? On each of these 6 dimensions, how did you do? We always suggest red, yellow, green scoring. It's the most intuitive, right? Green is you met expectations. Yellow is pretty good, some opportunities for improvement. Red is major opportunities on this skill. And you can see your performance on each skill, and then you also have the qualitative feedback on why did you get that score, right? And what could you have done better? And then you can do it again, right? And you can do it again right there. The replayability rate is quite high because it's dynamic, so it's going to be different every time because it's responding to what you're saying. and then maybe you go back to the classroom learning component, and then at some later point you come back and do the next part of the journey. So it is meant to feel like a quite intuitive platform where you can very easily see, here's all the things I'm going to accomplish over the course of training in these realistic simulations, and here's all the feedback that I've gotten.
Thanks very much. So you have the curriculum, and the AI interaction is this dynamic, simulated exchange that you might have.
Exactly.
One thing I want to add, if I can, just as the user customer, that I found so amazing about this. So the simulation is creating the other side of the conversation you're having.
Right.
When we teach parents to become coaches, one of the things we train on is open-ended questions, another is empathy. And so those are some of the skills that you're going to be practicing in the sim. What's genius about the sim is it does things a human couldn't do. We used to have our top-tier clinicians do this role play. The sim changes the way it speaks based on your use of the skills. So when you ask open-ended questions, it shares more information. When you ask closed-ended questions, it shuts down and stops sharing. Now, a real human client will do this, but a clinician is not going to change their personality in response to your use of clinical skills. But the sim does. And watching it happen in real time, it's just a breakthrough, right? It feels like magic.
Thanks
Feels
very
like
much.
magic. So we are actually running out of time for questions. I'm sure the team can stay after if you have questions for them. But as we round out, I wanted to just give our leaders an opportunity to share with the audience, what is the one thing that you want them to walk out of here today? Rapid fire, Tommy first. Emily.
Great. I think AI is super important, right? We know that. It's I think as Sam said, it's in the toolkit, it's important, and we are really thinking about it in a way where it's helping our workforce, not replacing our workforce, right? So we're using it in a way where we're able to say, how can we adapt and go into the areas that people need additional help on? How can we quickly triage young people who are at the most imminent risk for suicide? And so as we're thinking about these tools, for us, we still have humans on the back end who are touching that content, dealing with something as serious as suicide in the work that we do. It's important for us to have that human touch, that human element to it. So really, I often think of it within our context as a way to help us triage what is most pressing so we can very quickly get to that and solve and resolve that concern.
Emily?
Agree, humans are more important than ever, but I will add that the scope of the mental health crisis in our country is insurmountable without technology. We just don't have enough providers, and the barriers to care are so high that without technology we'll never get there. So I see AI as the thing that's going to accelerate harnessing the power of humans and the power of technology to reach everyone with quality care, which is, I think, the vision for all of us.
Yeah. I agree with those two. I would say it's really expertise-driven optimism, right? That you can be optimistic, but you're optimistic because each of the organizations we work with, and I think everyone in this room, is thinking about what are the actual problems I need to solve. You have the expertise, and then it's, okay, how do we bring AI into that? You can't do it without the optimism, but you can't do it without the expertise.
So just,
you have to answer it too, though. As the moderator, you have to answer it.
I'll say the addition that I will offer, because I think I can only add my contribution if we have the technology and the expertise, and we think about transforming mental health care through both the innovation and keeping humans in the loop. And we need both of those to inform the policy changes that we need around the country and around the world so that we can facilitate better solutions for more people at scale responsibly and not stifle innovation. And I just really appreciate the opportunity to facilitate this panel with you all and the expertise that you offer the audience and offered me, and look forward to continuing to learn from you and the services that you are providing today and will be providing for more people in the future. Thank you.
Thank you.